Let's welcome to go in depth health policy expert Betsy McCaughey, PhD.
Hi, Betsy. Thanks for joining us on America's Forum.
Well, you're quite welcome. And I heard Tom Frieden announce yesterday that the CDC would be imposing a new policy for healthcare workers coming back from Ebola-infested West Africa. But it's too little and it's too late. And the most astounding thing is that this new policy is based on political correctness, not science. In fact, it ignores science.
So you're saying this is a reckless move on the part of the administration?
It's a gamble, and I'll tell you why. We know from the biggest survey so far of the Ebola cases in West Africa that 13% of those cases do not develop a fever early on in their illness.
Right, so 2 to 3 days, correct, Betsy? You're the expert, but 2 to 3 days, correct?
They don't, but 13%
because the virus
don't
is
develop.
so mild that it could take 1 to 3 days. It may not show up in their system at all. I just wanted to clarify what you were saying.
No, that's not what I'm saying. I'm saying that for Ebola-infected patients, some of them develop other serious symptoms before fever. For example, diarrhea or vomiting.
Gotcha.
The New England Journal of Medicine published a very important survey October 16th assessing how over 4,000 of these cases have presented. So depending on fever to be the first symptom, as the airport screening does, is unreliable.
Betsy, let us talk about yet another set of CDC guidelines. You made mention of it. When we last got together, your concern was for healthcare workers in this country having definitive rules and having the knowledge to protect themselves. Are you satisfied with yet this latest round of CDC guidelines?
Well, no, because what I'm pointing out is that healthcare workers, as noble as they are to have gone to West Africa, and truly they are noble, can inadvertently spread the disease when they get home. One failure is the airport screening. The next one is this. The New England Journal of Medicine researchers found that doctors and nurses are not more likely to spot the illness in themselves sooner and get to the hospital sooner than non-medical people. So depending on the doctors and nurses who have come back to monitor themselves isn't enough. And the third and most compelling fact, scientific fact, is that that protective gear on which Tom Frieden is relying doesn't always work. It didn't work in the case of the infected doctor now at Bellevue Hospital in New York. And 244 healthcare workers, doctors and nurses, have died in West Africa so far this year treating Ebola patients.
You mentioned the name of Tom Frieden again. Simply stated, is it time for him to quit as CDC director?
Well, he certainly has. He's prevailed or presided over the decline of this agency. I call it the Centers for Denial and Confusion. That is what it is at this point. And yes, I think we need a new director and a focus on the core mission of this agency, which is not to tell people what size drink they should have or how often they should exercise. It's to control and stop the spread of infectious disease.
Betsy, with the only few seconds that we have remaining, what would you do if you were in charge of the CDC or if you were advising?
Well, I would impose a temporary travel ban, as Austria did just today. I would impose a temporary travel ban until we can ensure that the 4 biocontainment centers in this country are equipped to handle Ebola patients who mistakenly come here. And then we have to protect the rest of our hospitals, which are truly not ready to handle Ebola.
Well, it is a daunting task for a government that seems to have conflicting priorities and in essence seems to be making this up as it goes along. Betsy McCaughey, we're going to ask you to stay with us because there are so many additional issues we need to cover. Your background in public health and public policy, not only as a health policy expert, but as the former Lieutenant Governor of New York. We're going to call on it again following the break. Don't you leave us. There's more ahead with Betsy McCaughey.